Navigating Birth Control, What You Need to Know. Made by Maria Alonso Martinez, Irene Crespo Ramos, Neria Sanchez Forna, Marta Camacho Ramos. Here we present the different topics that we will cover throughout this presentation. 1. What do we know about contraceptive methods? 2. Types of contraceptive methods. 3. Wrong beliefs. 4. Sexually transmitted diseases. 5. Conclusions and recommendations. Contraceptive methods, commonly known as birth control, are a set of measures that people normally take to prevent unwanted pregnancies. Beyond pregnancy prevention, some types of birth control are also effective to prevent having a disease that could cause death. Practicing protected sex is the best way of having it. Contraceptive methods can be categorized into two groups based on sex: feminine and masculine methods. As we can see, there are many more types of feminine contraceptive methods than the masculine ones, even though hormonal contraceptive methods are way more harmful than non-hormonal options. It is uncommon to see a man taking into account these considerations when having sex. We can see a classification of contraceptive methods. Natural methods are planned according to fertility cycles. Next, barrier methods are those that prevent sperm entry without the use of hormones. Hormonal methods contain estrogen and progesterone. With these hormones, ovulation and pregnancy are prevented. Definitive methods consist of a highly effective permanent contraception that requires surgical intervention. Although these operations were initially irreversible, there is now a possibility of reversing them. Finally, the morning after pill is an oral hormonal method with a high dose of hormones that inhibits ovulation and fertilization when other methods have failed. In addition to preventing pregnancy, condoms are also used to prevent STIs, sexually transmitted infections. One of the main misconceptions is that birth control pills cause permanent infertility. The reality is that birth control pills do not cause long-term infertility. Fertility typically returns within a few months. Another misconception is that you can get pregnant during your period. While the risk is lower, it's not impossible. This is because the sperm can survive in the body for up to 5 days, which could overlap with fertile days and lead to pregnancy. The pull-out method, withdrawal, is considered one of the least reliable forms of birth control for several reasons. Firstly, even though the amount of sperm in pre-ejaculate is usually low, it can still be enough to cause pregnancy. Additionally, this method has a low effectiveness rate overall. Sexually transmitted infections, STIs, are caused by bacteria, viruses, or parasites, and can sometimes spread to other parts of the body, potentially leading to serious health complications. They usually result from having vaginal, oral, or anal sex with an infected partner. Some STIs can spread through non-sexual contact, such as kissing or close physical contact, from mother to child during pregnancy or birth, e.g., syphilis, herpes, through breastfeeding, in the case of HIV, or via contaminated medical instruments for HIV. Bacterial STIs are caused by bacteria and are often curable with antibiotics. Common examples include chlamydia, gonorrhea, and syphilis. Common symptoms are painful urination, yellow or green discharge, and abdominal pain. Viral STIs are caused by viruses and are often incurable. Examples include HIV, HPV, herpes, and hepatitis B. In conclusion, correct use of contraception helps prevent both unwanted pregnancies and sexually transmitted infections, STIs. It's important to rely on accurate information rather than myths. This video forms part of the project Fostering Cross-Cultural Collaboration with Artificial Intelligence in Service Learning. The project involves the University of Alicante in Spain, the University of Hradec Králové in the Czech Republic, IES Leonardo da Vinci of Alicante in Spain, and Vyšší odborná škola zdravotnická and Střední zdravotnická škola of Hradec Králové, Czech Republic. We would like to thank the READS program for their financial and institutional support, and the company Alicante Training for their technological assistance.